Hello, hello. Can everyone hear me?
Yes, we can hear you.
Okay.
We can't see your video, but we can hear you very well.
Okay. Greeting to my dear members of Parliament, mayors, director, organizers, speakers, and all participants to this APCAT webinar. I'm sorry for I don't have any presentation to show. I just want to speak roughly. Before I get started, I'd like to extend my warm welcome to all of us here and pass the best regard to your citizens at home. I thank Dr. Tara and your colleagues for having me here. Since the outbreak of COVID-19 in December last year and its rising infection in the world, the government of Cambodia has been long ready in preparing the fight against the new virus. The specific leadership mechanism led by the Prime Minister, the budget allocation, and the collaboration with the national and international partners, the organizations of the medical facilities, the medical frontliners, and even the voluntary teams of doctors and nurses. And we have done the same things at the provincial level. Since the first imported case in January, Cambodia has begun its action and so far confirmed a totally 122 infected cases, 121 of which have been fully recovered, and yet no fatality due to the COVID-19 until today. In my province, there are totally 16 infected cases, which the first one was found on the international tour river cruise ship in early March, putting local citizens in scared and the city in tranquility. And those patients have been medically recuperated after all. During this pandemic period of COVID-19, I am assigned to be the permanent deputy chief of the Provincial Anti-COVID-19 Committee, and we work as a team. On behalf of the governor, I joined to orientate the technical and behavioral trainings to the medical frontliners on how to deal with the COVID-19 since before it was imported into the province. To this regard, a scenario to challenge with the new virus has been designed with strong collaboration with the national CDC and the country WHO team. The isolation rooms and care services in all public hospitals in the province have stood ready. Medical equipment have been well organized. Medical frontliners have been well trained. The 14-day quarantine wards in the renovated hotel and local school have been well arranged. The process of containing the COVID-19 has begun with disseminating the health instructional messages to the local citizens by all means, especially on mobile megaphones in all villages every day until today, identifying and classifying the target suspected people, mainly from abroad, getting them to the checkpoint for the quick health check, conducting in place the specimen collections when suspected, admitting the suspected to the quarantine ward, and managing daily health track over the phone to the quarantine groups. All is free of charge. In addition, we're not only fighting against the virus, but also the fake news on the virus. It's important to inform you that there is only one qualified COVID-19 testing in Cambodia, the Pasteur Institute in the capital city of Phnom Penh, taking back and forth within 2-hour drive from my province, Kampong Cham. The result of the test takes no more than 1 day. Actually, Cambodia doesn't perform the whole country lockdown like some countries in Europe, or put the entire state in emergency like Thailand or Japan. However, the scenarios have been proactively ready based on the situation and time. Yet, some specific areas have been closed as responding measures to the spread of the disease. All schools and universities across the countries have been shut down. Entertainments have been discontinued. The gatherings have been proposed to minimal contraction. The celebration of Cambodia New Year was officially called off. and all the factory workers, public agency, and private company staff members were legally designated to work as usual during the pandemic. This pandemic has triggered more or less disruption in many areas in the province, including tobacco control. The first trimester meeting was cancelled due to the sudden existence of COVID-19. The provincial strategic plan of smoke-free city that I had proposed to be revised for stronger and more inclusive action has been deferred. Tobacco training has been delayed. Therefore, minimizing the scope of tasks to be done is the best choice for the time being. Delivering the smoke warning stickers on the doors of the business buildings, disseminating the tobacco control messages on air, mainly on the local radios. Although COVID-19 has caused severe fatality spreads of millions of people around the globe, it reminds us the leadership of a local government of what else should be done to improve healthcare system and encourage us to rethink and revise all development plans to fit in the contemporary world. It provides us more experience and ideas in making better, more proactive readiness tools to respond to the second wave of the COVID-19 as warned by WHO or any pandemic in the future. Well, let me congratulate the upcoming World No Tobacco Day this year in the midst of COVID-19 crisis. And I have something to say to the smokers around the world. No, any recent research proves what COVID-19 really is and how it exactly infects us. But you're so scared with it and you're tried to practice the solutions such as staying home, practicing daily hygiene, and so on for keeping healthy and happy. And how about the tobacco product? You know exactly what it is and how critically it can harm your health and raise the dream of your happiness. But why do you still commit it without panic? I know you always find your own reasons to smoke or ask questions to find the answers that just prove you right. Please don't try to seek the answer of how it can prolong your life or extend your real happiness. Look at yourself and value it. You're the best answer and you're the best solution. So give your family a real smile every day, not smoke. Stay healthy, stay safe, stay green, and the happiness is yours. Best wishes and take care, everybody. Thank you.